Exceed is the potent single-dose treatment for bovine respiratory disease and foot rot, providing demonstrated efficacy in a convenient, extended therapy ceftiofur crystalline-free acid formulation. Exceed has a unique base-of-ear site administration, which contributes to better carcass quality and a pre-slaughter withdrawal period of 13 days. With Exceed, producers have a long-lasting, cost-effective option for control and treatment of bovine respiratory disease. When administering Exceed, the injection is given in the base of the ear or the area where the ear is attached to the head. Administering anti-infectives in the base of the ear when the product is labeled for this route of administration contributes to better carcass quality without impacting the efficacy of the products being used. Before attempting any procedure that involves working with the head or neck area, be sure the animal has been properly restrained. It is important that you be able to position the animal in a way that is convenient and safe for you to administer Exceed. Keep this in mind when deciding how to restrain the animal. You may choose to use a halter, headlock, or cattle chute. As you prepare to administer Exceed, be sure the base of the ear area is clean and free of debris. You may need to use a mild cleanser to clear mud or manure from the area prior to giving Exceed. Be sure to always use a new or thoroughly cleansed syringe and needle when administering Exceed. A 16-gauge needle should be used for this subcutaneous injection. Prior to using Exceed, be sure to shake the bottle vigorously for 30 seconds to resuspend the product. Be sure to only inject Exceed through those routes of administration that are indicated on the label. The base of ear injection site for Exceed is characterized by the natural depression behind the base of the ear. This area is easier to see when the ear is extended forward. When the ear is flexed forward, you can actually feel the area with your fingers. The ear has a ring-shaped auricular cartilage where it is attached to the head. Right behind that is an area where the skin is soft and loose. This is the base of ear administration site for Exceed. When administering Exceed, it is important to make sure that you are injecting it into the loose subcutaneous tissue. You can check this by pulling back slightly on the syringe plunger once you have inserted the needle into the base of the ear area. If you see a flashback of blood in the syringe barrel, remove the needle and adjust its position before injecting. You do not want to see the flashback of blood when administering Exceed, as that means you have hit a vein or artery. Exceed has 3 approved routes of administration that use the base of the ear, giving you the ability to select the method of administration that works best for you. When administering Exceed using the opposite eye technique, hold the syringe and needle behind the ear that will be receiving the injection. Angle the syringe and needle along an imaginary line from the base of the ear through to the eye on the opposite side of the animal's head. Insert the needle into the loose skin at the base of the ear where it attaches to the head. Ensure your needle is placed in the loose subcutaneous tissue, checking to make sure you don't see any blood flashback into the syringe barrel. Inject the full dose of Exceed into the base of the ear, maintaining needle position until the injection is complete. With 7 days duration, Exceed is a hard-working option for managing bovine respiratory disease in your cattle. In addition, Exceed provides powerful treatment for the bacterial pathogens associated with foot rot. When you use Exceed, your operation and your cattle will benefit from a long-lasting, cost-effective option for control and treatment of bovine respiratory disease.